DO or MD, it really does not affect your ability to provide safe and effective patient care.
An MD or medical doctor and a DO or doctor of osteopathy degree program basically have the same end result. Both are licensed doctors in the United States. According to an article published by the American Medical Association in 2019 entitled Doctor of Osteopathy versus MD, or DO versus MD, How Much Does the Medical School Degree Type Matter? By Brendan Murphy, the discussion was focused on the difference between the two degrees and the requirements for attainment of both, and also the end result, what these doctors end up doing when they're done and graduated. So what is the main difference? Well, the focus is different in the two types of medical training in one specific area. MDs, or medical doctors, attend allopathic medical schools. Allopathy means science-based modern medicine, while DOs, or doctors of osteopathy, attend osteopathic medical schools, in which they do also train in allopathic medicine. But in addition to that, there's a specific set of time set apart for training in osteopathic medicine, which is, in a brief statement, learning about the physical manipulation of the body's muscle, tissue, and bones in order to aid in diagnosis and healing, or a more holistic approach to medicine. So there you have it. Pretty much the major difference is that osteopathic medicine trained physician, you will be learning to study a more preventative, whole person approach in addition to allopathy, or the pharmacology and physiology of medicine as well. So what's the difference in the requirements for admission for each program? Well, actually not really much. MD and DO programs have really similar educational admission requirements. GPAs have to be on the higher side, of course, as you know, and specifically the average was about a 3.5 to 3.6 average GPA, and MCAT score, again, a really highly weighted aspect of admission, was on the average 506.1 in 2019 to 2020's admission calendar year. The curriculum is also very similar between either of the two programs, with the first 2 years of education being heavily based in the classroom, and then the next 2 years being strongly grounded in the clinical clerkship or practical aspect of practicing medicine. So, as I've already alluded to, the main difference is that DOs require an additional 200 hours of hands-on study of the musculoskeletal system called osteopathic manipulative treatment. And this is defined as a study of hands-on techniques used by osteopathic physicians to diagnose, treat, and prevent illness or injury. So, as you might imagine, in med school, a DO will study a more preventative, whole person approach to illness. So if you're someone who desires to treat patients and with this focus, then pursuing a DO degree is a great path to take. One other difference with the DO degree path is that they often take an additional licensing exam called the COMLEX, Comprehensive Osteopathic Medical Licensing Examination, and often also take the USMLE, which is the examination that students pursuing the MD degree are required to take for medical licensure in the United States. There are 3 steps to this exam. So what can you do post-graduation? Well, with either degree, MD or DO, anything, actually any specialty that your heart so desires, you can pursue a residency and then eventually practice as a physician in the United States. However, some good statistics to keep in mind are that according to AOA's 2019 stats, about 57% of DOs practiced in primary care specialties, which, if you think about it, really makes sense. If the focus is on preventative medicine, this is the area of most impact. 31% of graduating DOs were family practice physicians, 18.1% were internists or internal medicine doctors, and 6.89% were pediatricians. So, to sum it all up, both MDs and DOs will learn how to employ the medical knowledge they acquire in a safe and effective way of caring for patients. So the path choice is really up to you. If you're interested in becoming a doctor, it's really advised highly to apply broadly to both degree programs to increase your odds of acceptance. And remember, if your goal is to become a physician, you should pursue very strongly all possible routes. With that, thank you guys so much for watching. Stay safe and take care.